This video is on medication administration. A quick review. Parts of a medication order. A medication order should include the patient information, date, the medication name, dose, route, time. If a PRN medication, it should also include the reason and parameters and a signature. You can abbreviate TORV for a telephone order read back and verified, or VORV for a verbal order read back and verified.
6 patient rights with med order. 6 patient rights with a medication order include the patient, the dose, the route, the time, the drug, and the documentation. A way that we can remember this is with the acronym, please don't rush the drug, DUG. So the first letter of each of those words corresponds with the first letter of each of the 6 patient rights.
3 checks with medication prep. Before giving a med, we should check it 3 times. First, when the medication is dispensed and first obtained by the nurse. Second, after the medication is prepared for administration. So a syringe is drawn up with the liquid medication inside and pills are counted out, etc. Then the third check occurs at the patient's bedside before administering.
Preventing a medication error. The way to prevent a medication error is to minimize distractions. So put your phone in your pocket, make sure there's nobody else in the med room talking to you, making sure there's nobody there to distract you. Be aware of alert and alarm fatigue. It's easy as nurses to start tuning out alarms, so make sure that when you hear them that you act on them. Watch out for medications with similar names, appearance, and packaging, etc. You're wanting to make sure that you're looking at medications that might look like a different medication so you can make sure you're giving the correct one to the patient. And always, always do your 3 checks, even if you're rushed.
A med error occurred. What do we do now? If a med error occurs, your first action is to assess the patient. Then, after completing an assessment, you can notify the PCP or the primary care provider of the error and of the patient's condition. Complete any new orders that you are given. After the patient is stable, then you want to be sure to complete full documentation of what happened. You can detail the incident using given safety reporting systems.
Needle safety medication prep. A way to be safe when we're drawing up medications and we're using needles is to keep the tip of the syringe and the base of the needle clean when you're putting them together. When drawing up from a vial, remove the cap and clean it for 30 seconds. That's called scrubbing the hub. Add air in your syringe and then putting it into the vial when you're withdrawing the medication to ease the process and prevent needle sticks. Keep your dominant hand or whatever hand you're not using away from the vial when inserting and withdrawing the needle.
Needle safety with med prep continued. We want to be sure to remove any large air bubbles from the syringe before giving medication to our patient. When recapping a needle, we want to avoid this as much as possible. Sometimes it's inevitable if we don't have enough supply. So when recapping is necessary, we're going to follow these steps. Place the cap on an alcohol swab, the edge of the table, or in a medicine cup to keep it clean. Then, when you're ready to recap, scoop the needle into the cap safely while keeping your other hand far away. Then you can tug on the cap at the base until you hear a click.
Needle safety with med administration. To make sure that you're safe when you're using the needles is find your injection site using proper landmarks. You can watch our other video about that. Clean the skin in a circular motion. So you want to start from where you're going to be injecting and then going 2 inches outward from the injection site. Let the alcohol dry completely before injecting. Don't fan it or blow on it. Inject at an appropriate angle. So if injecting at the angle less than 90 degrees, make sure that you're keeping the bevel of the needle up.
Needle safety with MedAdmin continued. Once an injection is given to the patient, you never want to recap your needle. This is the most dangerous time that you could stick yourself because you would be exposed to possibly the medication and any bloodborne illnesses that the patient has. So to avoid that, we never recap. We always engage the safety device at the end of the needle and place it immediately into the sharps container.
If a med error does occur, what do? So first, you're going to clean the area. Then ask the patient for medical history regarding any bloodborne illnesses, but keep in mind the patient may refuse and they are allowed to do that. Undergo any testing or screening needed and make sure that you report this to leadership and safety monitoring so that hopefully this can be prevented in the future.
Thank you.